Nursing students, time to talk. Welcome to the Real Talk School of Nursing podcast. I'm your good and faithful host, Michael Smith. Thanks for continuing to subscribe to the show. Write into the show at realtalknursing@gmail.com or use Facebook Messenger or contact us through Instagram or Twitter to share your experiences, ask questions, and give feedback. Thank you to everyone who started following us on Instagram, Twitter, and Facebook this last week. More listeners means more and better shows. Make sure to share the episode with classmates, especially our junior cohorts and underclassmen. This show is about mentorship and stewardship, so let's give a hand up to those who are coming behind us. Let's build a community of fun, engaged, and supportive nurses and nursing students. We have a great show for you today. Joining us from the UK to promote her book, The Language of Kindness, A Nurse's Story, is nurse Christie Watson. So with that, let's get this show rolling.
If you like the show, the Real Talk School of Nursing podcast is available on iTunes, Google Play, iHeartRadio, Libsyn Web Player, Stitcher, YouTube, Spotify, and SoundCloud. So, go wherever you download podcasts, subscribe, rate us, review us, write into the show, and smash that subscribe button. Remember, only leave 5-star reviews. That's the only rating that counts to get us noticed by more nursing students. Write into the show at realtalknursing@gmail.com or on Facebook Messenger. You can also join us on Facebook, Twitter, and Instagram. We're building a community of fun, supportive nursing students, and I want you to be part of this crazy nursing school journey.
Okay, so first, welcome to the show. I appreciate you taking some time with us. It's 11 o'clock here, so it's 5 or 6 hours ahead for you.
Yeah, it's 4 o'clock. Thanks so much for having me on.
So you start off your nursing journey in the book, like many of us do, by a set of experiences, by a whole series of experiences, not just a single thunderbolt decision. Can you kind of walk me through that decision to become a nurse?
Yes, I guess it was unconventional in many ways. I certainly didn't feel like a born nurse. I had so many different career aspirations and ideas. I went through everything possible from jazz trumpeter to singer to scientist, lawyer, everything that you can think of. And eventually I settled on the idea of becoming a marine biologist. And I was really focused on that because I thought that it involved swimming with dolphins and wearing flip-flops all year round, and I was delighted by that idea. And then I found out that to study to be a marine biologist in the UK, really you have to go out to Wales, and it's pretty cold, and study plankton for 3 or 4 years. So I had a rethink after that. And so I didn't have any direction at all, and I didn't know any nurses, but I began to volunteer for adults who had physical and learning disabilities. And then for the first time ever, I was around these nurses, and I remember just being mesmerized by them and completely in awe of what they were doing. And they just seemed to have that brilliant balance between head and heart, with all the skills they were using to look after people, but the compassion as well. And I was really drawn to it. So I think it was watching them that encouraged me to fall into nursing. And I was 17 at the time. I think the entrance age is a lot higher now, but I started at 17.
So in the US, there's a lot of programs where you have to have all of your prereqs already in place before you can even apply to a nursing school, and things were a little bit different, it sounds like, over in the UK.
Yeah, I think nowadays you have to have your science A-levels. You have to have 3 A-levels, and it's a degree course. So it's the same as any other university degree program, essentially. You have to have the UCAS points, and probably it's a bit more similar to the American system now. But certainly when I started, which was sort of 1998, it's quite a while ago, I slipped in without any qualifications. I had GCSEs, which were my basic 16-year exams, and then no A-levels, no degree, nothing else like that. And I just I suppose I was very lucky, because I think now I'd have struggled to get on a nursing course now.
There's through the show, like, I've started to separate the show into 3 segments where we talk about pre-nursing school, so your prerequisite courses, and then your courses as a nursing student. and then, kind of getting just at the very beginning of the nursing career, especially boards. And you guys don't do boards, but while we're talking, so you didn't have, when you say that the 4-year or the nursing programs are like a full course, how many years does it take for you guys to become a nurse, or at the time, maybe now?
So it was 3 years when I did it. It's still 3 years for some places, and some places it's 4 years.
Okay.
And so I guess you're 4 years, is that right?
Most bachelor's programs are 4, and they have an associate's or like an entry level nursing program that's 2, but they really start pushing the 4. They've really pushed the 4-year more recently.
Same here. And I think that's right, because our patient population now, and I'm sure it's the same in America, people are so complex and their needs are so complicated, and so I think nurses do need as many qualifications and skills as they possibly can get before starting out on the job.
Most of what it sounds like from the book a lot is that there's a lot of different, and we're kind of jumping all over the place, and that's okay. We're a lot of the hospitals. So who owns the hospitals, or who runs the hospitals? Are they private enterprises? Are they all state owned? How does that work?
So it's mainly the National Health Service, which is public hospitals, which are free at the point of entry for anybody. And they're pretty, the best hospitals in the UK are state-run, they're government-run NHS hospitals, and they're the free ones. I mean, we do pay for them because we pay for our National Health Service in taxes.
Sure.
So people pay the taxes, and then it funds the service. There are some private hospitals. I think increasingly a number of private hospitals and private healthcare options available in the UK, but certainly in my experience, the very best nurses and the very best doctors go and work in the National Health Service, which is a state-run health service. And if you're very, very ill, if you're critically ill or have got something unusual, then I would recommend going to the National Health Service as opposed to private hospitals. I think private hospitals in the UK are very good for knee replacement or something where you need to have a short wait time.
Mm-hmm.
But certainly I've cared for seriously or critically ill children who've been moved back to the state-run hospitals because the private hospitals just didn't know what to do with them. So they were sent back over. So I think it's a very, very, very different system. It's almost a completely different landscape to the one that you have. But increasingly we're seeing privatisation here.
It just sounds like the private ones are more like specialized clinics and stuff like that, rather than a soup to nuts, med surge to specialty floors.
They do have private hospitals that do absolutely everything from intensive care to absolutely everything you can think of. But it's mainly National Health Service here, and people, rich and poor, young and old, of all backgrounds, tend to use the National Health Service unless they have something like private medical insurance because they work for a particular company.
Sure.
And then they might use the private system.
So let me switch gears. So let's talk about nursing school, like your nursing school experience a little bit more specifically. So your nursing school experience sounded much different from the American model of school, a lot more cloistered at the time, and perhaps maybe just in that school. Can you, where here, I don't think there's anything, and maybe it's just my interpretation of the book, but it's just either an associate's program where most students, live at home and attend classes and clinicals, and then a 4-year where they're either living at home or living on campus. But there's no difference between, a nursing student and, a philosophy student, a philosophy major, as far as the college is concerned, where you guys seemed a lot more cloistered, where you're housed together and much more of a very tight-knit cohort kind of group.
Yeah, it used to be like that. It's very much the American system now. In terms of nursing students are the same as any other student at university now. It wasn't like that when I started, but certainly that's the case now, and it's a bit problematic here because nursing students also do their clinical placements. So, for example, my friend's son has just come back from the summer for holidays, and his mum sort of asked him how's it going and who's left at uni then, and he said, oh, no one, just all the nursing students, because they're still having their clinical placement.
Yeah.
During the times when other students off. So it was just really unfair, I think. You know, they're actually working as well as studying, as well as being a student and doing all the rest. So I think being a nursing student now is probably harder than it's ever been in that sense, because they're kind of not like other university students. Other university students don't need to do a 12-and-a-half-hour night shift on a surgical ward. And it does mean that they can't take part-time jobs in the same way that other students can as well. So it has a financial implication for them, and our nursing students here certainly really struggle with financial hardship. But when I started, which was 25 years ago, 30 years ago, no, 25 years ago, I'm not that old. When I started, it was mainly the same. We had blocks of time where we were at university and blocks of time where we were on the wards. But we also had things like we were very much together with the medical students. We had anatomy and physiology exams almost weekly with the medical students. There was much more integration, I think, with the doctors. And as you said, we were kind of grouped together. So there was really, we socialised together, we lived together, we worked together. It was very close-knit. And I am glad that I studied at that time, because I think there was real benefit in having that emotional support, really, of being like a family. I don't know how it is in America in terms of nursing halls and student accommodation, but like you said, I think most people now tend to live at home or live away from campus.
There's, I think for the traditional brick and mortar 4-year BSN, the Bachelor of Science in Nursing, they tend to be, fully integrated into a normal campus where they're living on the same floor. So, and I remember my college experience where I was in ROTC. So that's the commissioning. That's how you get commissioned into the Army to become an officer.
Oh, wow.
And we were a premier nursing school. So we had a lot of nurses in that program. And I think they were better supported because they had other ROTC students around them to support them. But I had other friends who were also nurses and not in ROTC, and I think they really struggled because they didn't have that. Their roommates were just normal students, so they could go out partying on Saturdays and get back at 3:00 in the morning, and my friends would be have to be up at 5:00 because they've got to be in clinicals at 6 a.m. And there's not that togetherness, that family cohesion that I think would.
That's really tricky.
I think I look at that program, I kind of reading through the book, and I was like, God, that'd be really cool.
Yeah, it was really cool. It was really cool in so many ways. And I think having that understanding of someone who's not a geography student or something is really important, because the other thing is nights. Nobody really understands nights unless you work night. and when somebody's, waking you up at lunchtime to ask if you want lunch, and you're kind of explaining, well, it's the middle of my night. It's really hard. It's a difficult concept to understand unless you work nights or you're a shift worker. And like you said, people going out because it's Saturday night, but your Saturday night might be Monday morning.
Yep.
It just depends on your shift pattern. But it was incredible to be such a team, and I think that this really amazing teamwork still goes on. But there was certainly no hierarchy in terms of, we all just did everything together, and we were particularly close during difficult times. And I certainly remember the worst days at work, where after work, we'd all go out for a drink, from the consultant to the student nurse to the porter to the physio to the cleaner. Every single one of us, even the chaplain came, and it was good for, I suppose, it was therapeutic in the way that we could all just laugh and cry together. That was important.
There's one of the reasons I really like working as an ER nurse is because we have a much closer relationship with the physicians and stuff like that.
Yeah,
You know,
I think it was, I read this great quote this week, which was that, because I'm intensive care by background, and in intensive care, we're forever trying to put things into holes like CVP lines and arterial lines and everything else. And
every hole has a line, and if there's not, every hole has a line, and if there isn't a hole, you'll make one and put a line in it.
We'll make one, and then you guys are trying to pull things out of. And so I thought that was pretty brilliant. It was like, I think ER and ICU are quite similar in many ways in terms of the level of teamwork that you have with across the board with all the members of the healthcare team. And I think that I was going to talk to you about this actually because I find it quite interesting, but certainly in America, I think, and I understand that nurses are seen to be pretty prestigious profession. Would I be right in saying that? It's quite, people kind of really respect the nursing profession. I
think so. I think there's, particularly because it's so difficult to get into a program and stay in it, and that's the bigger issues. Is I think even people who haven't been through nursing school and they can't really relate to that experience understand that it's not something. It's not for the faint of heart. Like.
Absolutely.
So I think the nurses in the U.S. are continually, like number one or number two most trusted professionals. You know.
So we also have consistently the most trusted professional rating in the UK, but there is a perception here that's quite different of nurses, and I do feel like we're struggling a bit with perceptions. There's a lot of work that the government's doing to try and change perceptions of nursing because our numbers are poor, and people are, we don't have enough nurses like America, like everywhere else in the world. But I think partly that's about the old stereotypes that still exist here, particularly where people think that nurses are somehow handmaidens to doctors or just a nurse. We hear this narrative, just a nurse. In some way just doing the compassion and kindness and care, which is amazing, and that is part of what we do, but people don't understand the academic rigor, they don't understand the leadership skills and everything else that goes into being a nurse, I think. So I think we've got a lot of work to do in the UK to get to the level that you're at in the US in terms of perceptions of what nurses actually do and are.
Well, I can tell you that no one has ever accused me of being a handmaiden.
Yeah, well, I think there's always a first. No, we do, and I think it's perpetuated by television as well, and things that we see in the media. But I get interviewed quite a lot, and I get asked all the time if I should have just become a doctor. Wouldn't it have been better if I'd become a doctor? And I find that quite offensive on many levels. But I also get told things like, "Oh, nurses are just angels. They're just angels."
Are you tired of the same old badge reel? Do you have to wear the same scrub color as everyone else? Are your undershirts boring and pretty stinky after wearing your lucky shirt through 5 12s in a row? You can wear your personality in other ways. Go to badgeladybynerdwear.com and check out her massive selection. Tell her you're a Real Talk School of Nursing podcast listener and use the promo code REALTALK20 at checkout for 20% off your order. Expect 2 to 3 weeks for custom orders and a few days depending on her actual job schedule to get your badges made and shipped. I know you'll treat her like your best friend at clinicals, so go to badgeladybynerdwear.com and order the coolest custom and original badge reels out there. Go to badgeladybynerdwear.com and use the promo code REALTALK20 for 20% off your order.
You're listening to the Real Talk School of Nursing podcast with Michael Smith.
I get asked repeatedly if nurses, for example, I was awarded an honorary doctorate from a university here, and I've now got a Doctor of Letters, which is amazing. It's like a higher PhD. But when people read that on my bio or anything, the amount of people that ask me, well, why didn't you just go and be a doctor? And I find it quite offensive, and I also highlights people's lack of understanding about what the job of a nurse is, and people do think it's almost the same as a doctor but less than a doctor. I'm forever arguing with people that it's a completely distinctive and complicated profession that's absolutely important in its own right. And we do get a lot of problems with people thinking that nurses are angels or sex addicts of some description. So we have one or the other in television and on media. Portrayals of nursing here are really one or the other extremes, like angels or devils, which is completely inaccurate, obviously.
We have you mentioned how we're portrayed in the media and television and stuff like that, and do you guys have Grey's Anatomy over there? Do you watch that show?
I haven't watched it, but I'm looking forward to it. I hear good things about it, actually. Is it good?
I don't think so, but that's not really my my forte. But I think what you say really hits the heart of that program from my perspective. In that nurses, like, you don't even see nurses. Like, I have never seen a doctor put in a Foley catheter ever. I have never,
wow.
like, there, and as a former EMT, prior to becoming a nurse, I was an EMT, and if nurses aren't seen in television, techs are non-existent, or techs or what we call CNAs, so the nursing assistants on the floor, and I really do feel like they are. I mean, if nurses have a bad reputation, the techs and the nursing assistants really get no credit for the hard work they do, because when was the last time you saw two doctors in the same room cleaning up a patient? Never.
It's absolutely true. I'm writing a television series at the moment. I'm kind of working with a production company here in the UK called Mammoth Productions, who have asked me to write the script for the book. So I've been busy watching a lot of television and in the name of research, and also lots of television about nurses. So I'll definitely look out for Grey's Anatomy, but it sounds like that's more about the lack of nurses, perhaps. Really hoping to get something onto television which reflects the truth about being a nurse, or at least highlights some of the truths about being a nurse.
One of my nursing instructors said something really beautiful, and she goes, and we were talking about end-of-life care, but I think what she said really applied well to the rest of, healthcare in general, in that, when there's nothing more that medicine can do, there's nursing can do so much more. And it wasn't just what she said, but it was her hand gesture, and it's like when nursing happens from the moment they walk through the door until they walk back out, and there's plenty of nursing services that happened beyond the doors of the hospital, beyond the doors of the clinic, and so we're serving the patient the entire time, regardless of whether or not they're getting medical care. And that, I think that is a really beautiful and very true statement about what
beautiful.
nurses.
I totally agree. Yeah, I think it's about, because we're living in an age as well where medicine and technology is not always going to cure our human condition, and certainly patients that we see in the UK, they're suffering from physical and mental, emotional, social comorbidities. Everybody's got more than one thing wrong with them, and a tablet or a piece of technology is not necessarily going to help in the way that it might have done before. And actually what does help is excellent nursing care and a holistic package, like you said, between the hospital and out of hospital service.
So,
and it's really important to
No, go ahead.
Sorry, I was going to say, I agree with your nursing tutor that nursing doesn't necessarily seek to cure. It's not about curing necessarily. It's always about saving, but it's not necessarily about curing people. So I think that's beautiful.
You're listening to the Real Talk School of Nursing podcast.
Can you talk a little bit about some of your, specifically your nursing school experiences? And it can be, let's start on the upswing. So tell me about a really positive memory, a really positive experience from nursing school.
So I had a lot of positive and negative. I would say they were mostly positives. I think that the most positive was always about teamwork and colleagues and co-workers and fellow student nurses who were such an amazing support. But I think one of the funniest things that happened, and I write about in the book, and I know she wouldn't mind me talking about, was it's not really positive, but it's just funny. When I talk about a patient who I watched a heart-lung transplant when I was a student nurse, and it was to this day one of the most extraordinary, astonishing things you could ever imagine. And it was the first operation I'd ever seen. Imagine that, going straight in a heart-lung transplant. It was terrifying. So I was really right in at the deep end, going straight into that. And I was standing next to my friend who was a student nurse as well. I've called her Jess in the book.
Yep.
And Jess basically started moving her theatre mask up really high until you could just about see her eyes. And then she moved her theatre mask down. And honestly, you could only just about make out her eyes. And I said, Jess, what on earth are you doing? And she was behaving so strangely. I said, Jess, what's going on? And she leant over to me and whispered, I've had sex with everyone in this room. So she basically is now proving the myth that nursing students or nurses are actually devils. But it was one of the funniest moments ever. And I had so much humour and so many funny moments like that. Another time I had the worst day, actually, but out of the worst day came the nicest experience because I was looking after a child who had diabetic, who was in a coma, a diabetic child, and she was really, really, really sick, and she had her blood gases were incompatible with life. She had a pH of 6.9, I think. And so all the nurses on the ward were kind of preparing me for the possibility that this might be a child that doesn't make it, and I hadn't experienced anyone dying at all. And basically about a week later, because I'd been really crying and worrying about it and really stressed, thinking, it's just the worst thing. I don't think I'm going to be able to get through this course, and I'm going to have to leave. I just can't cope with this. And then I found out one of the nurses came and told me that she'd survived and she was doing really well and she was on the ward, and would I like to go and see her? And so I went with this nurse who was my mentor at the time, and we went along to see her, and she was sitting up in bed, she was blowing bubbles, and she looked really well. And it wasn't so much the child getting better that made me have such a brilliant day, although that was obviously the most amazing outcome possible. It was the support that I had from the mentor. It was the support I had from her, realising that I was struggling, and on her day off, actually making time to come and tell me that everything was okay. And it wasn't always going to be okay, but in this time it was okay. And it kind of propelled me to understand that not every adult child, whoever you're looking after, will get better, but if you've got the support of your team and your mentors, then you will be able to get through the job.
From Tim Duggan Books comes #1 international bestseller, The Language of Kindness, A Nurse's Story by Christie Watson. Available in softcover, as an ebook, and on audio from Penguin Random House. Christie Watson spent 20 years as a nurse in the UK, and in this intimate and powerful book, she opens the doors of the hospital and shares its secrets. She takes us down hospital corridors to visit the wards and meet her unforgettable patients.
All of us will experience illness in our lifetimes, and we will all depend on the vital care and kindness that nurses offer us. Yet the people who form the vanguard of our healthcare system remain unsung, at least in the UK. In this age of fear, hate, and division, the language of kindness reminds us that we share and have an urgent need for compassion. Pick up your copy of The Language of Kindness by Nurse Christie Watson. It's available as an ebook and on audio from Penguin Random House.
So let's switch gears and kind of get into the meat of the book, and we'll start talking about your nursing career a little bit. Can you give me the, quote unquote, the short version of the places, the departments you worked in?
Sure. So I started out in mental health nursing. I wanted to become a psychiatric mental health nurse, and I swapped and changed after 18 months. I worked with some children and adolescents and absolutely loved it, but mental health wasn't a good fit for me. And so I switched over and went to train as a children's nurse, and I was a children's nurse for pretty much my whole career. I worked in pediatric intensive care and on retrieval services, which is basically where you go and pick sick kids up from around the country and stabilise them and bring them back to the tertiary centre wherever you're working. So it was high level stuff, very full of technology and saving lives. And then I worked my final few years as a resuscitation nurse, which is when I started working with adults again. So I was on 5 different crash teams: the obstetric, neonatal, adult, trauma, and pediatric. So I've always been, I guess, at the cracking chest and technology and that side of things, and I think that's about my nature as a control freak. I'm quite a control freak. And I worked a short stint in the community, and I found it terrifying. I think I've got so much respect for community nurses, because I was completely alone, and making those decisions on my own was just beyond my comprehension. And I felt much more secure with technology around me and with a whole team of experts around me. And I think the beauty of being on pediatric intensive care, or again in emergency department, I imagine it's probably the same. Certainly on the resus team, you've got all these amazing experts around you at all times. So I think working on a general ward or in the community scared me too much, and I have the utmost respect for those nurses who don't need to hide behind technology in the way that I certainly needed to.
So let's see, can we go through a couple of excerpts through the book?
Yeah, sure.
I'm particularly fond of the Baby Murphy story, and where you are a new nurse, and I particularly liked how you wrote about the midwife. She sounded very much like one of my nursing instructors, who was she was an immigrant, and just a powerful woman, and the way that you described her was so very, just like, no, you look at me. And can you talk about that, the Baby Murphy story, and a little bit about the midwife?
Sure. So I was working on a cardiac intensive care unit, and I was sent to the labour ward with a canister of air, because they told me a baby was being born who had suffered a hypoplastic left heart syndrome, which is a really complicated congenital cardiac problem. And the thing that was really dangerous for this baby after he'd been born was having oxygen, because that closed the ducts, and then there were issues with oxygenation. And so I was basically just sent with a canister of air to stand there, and if anyone went near the baby with oxygen, to just intervene and give them air and remind them, and just sort of be an oxygen gatekeeper is what I called myself in the book, which is a kind of nothing job, but it felt very important at the time.
It's not much, but it's honest work.
It's honest work. It's hard day's work. I mean, that oxygen canister was heavy, I can tell you. But I was standing there poised with the oxygen canister, ready air canister, sorry, that would have been bad, ready to step in and intervene. And I was clueless, really, I'd seen one birth before, but this was quite different. And the midwife, I've named her Preeti in the book. She was a tiny woman. And like you said about your mentor, she was absolutely fierce. She was, in terms of life goals, I think I want to be her, definitely. She was amazing because she had a quiet, soft voice, but it was the kind of voice that everybody listened to. And she was such an advocate for the woman who was giving birth that everything just felt calm and in control because of her voice and the way she was advocating. She was putting her hand up to stop anyone approaching, and she was just there for the mother, who I think I've called Claire in the book. And that situation could have been absolutely terrifying, and it still was really scary because his child was being born. We didn't know what kind of condition he would be born to. But actually, because of her, everything felt calm and in control. And I suppose that's the case when you have such an experienced midwife or nurse on the floor, that everything just feels calm, no matter how difficult the situation it is. And he was born without a name. And so he was baby Murphy, and I looked after him after his first operation, which was something called a stage 1 Norwood's procedure. It was a pretty heavy operation, and he was still nameless. And I wonder now whether they purposefully didn't give him a name, because there was a lot of discussion about the name, and I wonder whether they waited till after the operation to see if he would survive, because they just couldn't deal with giving him a name should he not survive. And then his sister, his big sister, who was about 4, I think, she came to visit, and everyone was worried that she would be traumatized by seeing all the wires and chest drains and pacing wires and everything else that was going on with him. He was ventilated, obviously, and it was quite a scary environment for her. But she came in and she just stroked his head, and she said, "My brother looks like a robot." And so they called him Robert, which I thought was just beautiful, absolutely beautiful. And he survived, and as far as I know, did really well in all his operations, and is living a very normal, healthy life now.
The story really, like I felt a lot of kinship with the story, because as a nursing student, especially as a male nursing student, I got a rare opportunity to go to labor and delivery, and mostly because it was probably going to be the only time in the span of my nursing career where I was going to be able to go do that. And so I just, I jumped at the chance. It was very, it was basically, I drew the long straw and I got to go. The nurses go in and they're like, "Wow, we've never had a male nursing student here before. And we're going to ask the mothers, if it's okay." And, it's like, they might tell you no. And I'm like, well, that's, at least it's not me who's saying no. So I was like, okay, no problem. And one of the mothers said yes, and she was a nurse practitioner, and that was a great. I thought that was a great display of mentorship and stuff like that, because she knew this was nursing school, and she had been through all that before, and so and it was her third child, and so she was an experienced mother, and I don't know, do you guys have nurse practitioners there that kind of like a hybrid between a doctor and a nurse, or a provider?
We have midwives. Midwives here do everything. I mean, in the way that your obstetricians do everything. We don't. It's not medically led. It's midwife led. Mm-hmm. So they have the same level of qualifications as nurses. They've got registered degrees. They go to school for 3 years, and then they have to deliver 40 babies, and then they are qualified midwives, and they basically run the show. I mean, we have midwifery-led units where you don't see a doctor at all throughout your whole pregnancy until you've got the baby. You just haven't seen a doctor. So that's quite different from your system. Certainly we have, There's no difference. We have good mortality rates, and it's going down slightly, I think, to do with poverty at the moment. But if there's a problem or a high-risk pregnancy, or if there's something unusual going on, then it will get transferred to the doctors, and there'll be an obstetrician present. Obviously, if it's a cesarean section, then it gets transferred to the doctors. But usually, in healthy, normal labours, deliveries, it's led by a midwife, and a midwife can be a man or a woman. Mm-hmm. Increasingly, we're seeing very, very few, but increasingly we're seeing male midwives. And it's quite nice to see, actually, because there isn't any difference between an obstetrician being a man or a woman and a midwife being a man or a woman. It's the same, really. So it should be it shouldn't really be about gender, I don't think. And to be honest, as someone who's given birth, I wouldn't have cared if the army had come in, honestly. I just wanted the baby out. And if you'd been, the National Guard or something, I wouldn't have minded.
You talked a little bit about your experience with surgery as a nurse. Can you talk about some of your other experiences in theater?
So my very first job was in a neurosurgical unit of Great Ormond Street Hospital, which is a famous children's hospital in the UK. And I worked with children who were having surgery to remove brain tumours, who were having something called ventricular peritoneal shunts put in because they had hydrocephalus. Yep. And I remember watching a VP shunt insertion and assisting in that. And I thought it would be quite straightforward because it's essentially a tube to drain the fluid. Mm-hmm. And so it sounds non-technical, really. But it was the most barbaric surgery I've ever seen in my life. I mean, I have never I'm still shocked by this surgery. It looks medieval, and I guess there are a lot of surgeries that still do look medieval because that's where they started and they work, so why change them? But I think the VP shunt insertion was certainly the scariest surgery I've ever seen. And I've also seen brain surgery where the patient has to be awake, which is a bit Hannibal Lecter, Silence of the Lambs. It's a bit disgusting, and that always makes me feel really queasy. So I'm definitely not somebody who's cut out to be a scrub nurse. Definitely.
You had a really kind of funny quote from a member of U.S. or of UK Parliament from like 1800, Lord Thurlow.
Okay, yeah.
And it says there's no more science in surgery than butchering, and having seen an orthopedic surgeon, it looks more like fixing. It's more like you're fixing a fence post than surgery.
Yeah.
Oh.
And they're really big, aren't they? And there's a certain type, you can almost tell where people work if you've been doing the job long enough, not only from personality, but sometimes by sort of shape and size. And you can always spot the orthopedic surgeons.
It's like the dentists all have really large hands.
Yeah, exactly. But it's quite something to watch a surgeon in action. Maybe not orthopedic surgeons because they're there with their hammer and chisel, but I think to watch surgery and watch a surgeon's hands, it's very beautiful. It's almost like a ballet. It's like watching a dance. There is something really lovely about watching surgery, just to watch the surgeon's hands, whoever that might be.
One concept kind of later on in the book in chapter 12, you talk about and this one struck me very hard for two main reasons, because my university education put the nursing theorists up on a pedestal that thou shalt not touch, and you had the audacity to disagree with Hildegard Paplau.
Oh God, I know, right?
and
I'm keeping a low profile.
And I too, especially with the quote that you pull out, I couldn't also disagree more. So I agree with you completely, and in a practical manner, when it comes, even when a patient lives, there's there's some of that never leave us. The theory, the heart of the theory is the concept that the nurse-patient relationship is very temporary, and that just, I mean, even because the chapter talks about death, but even when the patient lives, it's not a temporary relationship, and especially, not especially, but including in, you know, an A&E in the UK or in the ER where you're seeing patients in and out in a very quick manner, where a long stay is 6 or 8 hours in an emergency room versus, you know, 6 to 8 to 12 weeks in a med-surg floor. The audacity, Christie, the audacity.
I know, I feel bad about it, but
You shouldn't.
I think that I had the same experience. I remember so many hours studying theorists, Peplau, Hildegard, you know, everybody that I could think of, and never quite understanding what was happening, and never quite understanding, because everybody slightly contradicts everybody else. And I think that's because nursing is really difficult to get into language or understand in an academic sense. It's almost a kind of faith. It's almost a spiritual thing, because it's a faith in every single human being, regardless. And it's something that is poetry, and it's dance, and it's literature, and it's politics, and it's art, as well as all the sciences and all the humanities. And to get that into a single theory has baffled people, I think, for years. But instead of saying, look, it baffles me, it's just something that we don't quite understand. We know it involves the head, the heart, an immense amount of skill in academia, as well as compassion and kindness. Instead of just saying that and moving on, people have been, I suppose, compelled to write really, really dry academic textbook after textbook about what it means and what it is to be a nurse, in a way that's quite inaccessible, I think, at times. And yeah, I do agree with some of it. I also think that the emphasis on trying to understand that theory in nursing school is perhaps a little bit overarched, because I think that there is so much that we can learn, for example, by narrative nonfiction, by storytelling, by thinking about nursing in terms of poetry, that I don't think nursing school really utilises the whole of what nursing is. And of course, it's an academic subject, but there's lots of ways into medical humanities. There's actually at Columbia now an MA in narrative medicine, which is attracting nurses and doctors, I think. And that's so important, but I've yet to see that being taught as a module in nursing school. And the narrative side of nursing is so essential, and it really is much easier to understand, I think, as well. The stories that our patients tell us, how we hear them, how we respond to them, our own stories, and how those dance with the patient stories, and that incredible human process that's going on all the while that the nursing is happening, and thinking about patients in terms of just a jigsaw puzzle, you know, and the illness is just one small part of that puzzle. So I think that disagreeing with the theorist is absolutely right, but I wouldn't recommend it, because I've had a lot of lessons about that. I wouldn't recommend it. I think that there are I don't know how it is in America, but I think here we do have a problem with nurses disagreeing with each other quite publicly, and sometimes not in a very respectful way. And I'm forever saying to everybody, look, nursing is not one thing or another thing. My way of nursing is not necessarily your way of nursing. And it's a language with many different accents. And it's absolutely okay to disagree with each other, but still stand side by side and have that strong union voice, that strong political voice, and still believe in what we're doing as a united front. Because I think it's very unhelpful when nurses disagree disrespectfully. So hopefully I've disagreed respectfully, if that makes sense.
Are you tired of the same old badge reel? Do you have to wear the same scrub color as everyone else? Are your undershirts boring and pretty stinky after wearing your lucky shirt through 5 12s in a row? You can wear your personality in other ways. Go to badgeladybynerdwear.com and check out her massive selection. Tell her you're a Real Talk School of Nursing podcast listener and use the promo code REALTALK20 at checkout for 20% off your order. Expect 2 to 3 weeks for custom orders and a few days depending on her actual job schedule to get your badges made and shipped. I know you'll treat her like your best friend at clinicals, so go to badgeladybynerdwear.com and order the coolest custom and original badge reels out there. Go to badgeladybynerdwear.com and use the promo code REALTALK20 for 20% off your order.
Okay, so let's go into the last segment. This show centers around 2 main values, and that's stewardship and mentorship. And can you please share some advice for nurses at the 3 different stages that I use through the nursing school journey? So first, prereq students, nursing school students second, and then new grads, people who are entering their field as new nurses. So let's start off with prereqs.
So your prereq, just to describe to me what that is, because I don't think we have that here.
So it's it's a student who is taking the anatomy and physiology, the microbiology. It's all the prerequisite courses in order to apply to nursing school.
I see.
So they're learning. I think that's a time where they need to primarily focus on time management and getting used to the workload and putting their personal lives, organizing their personal lives in such a way that when they get to nursing school, they are able to withstand the pressure of it and the timeline of it. And so that's kind of that time of their life. So the prereq student.
Okay. So I suppose my advice would be similar to yours in that I think it's a time, I suppose, or even though it's before, it's actually a time of reflection about what's to come, I think. And the more organised you can be in terms of study skills, the more you learn study skills, the better and the easier it's going to be as you go through. So anything that you can do to give you a head start is a really good thing. You can actually access, I'm completely sure, nursing reading lists, for example. And so you might read a couple of the books in advance of going to nursing school, knowing that you're going to have a really heavy workload coming up. I think just preparation. But also, I think although it's really important to get everything in order and organised and start organising personal life and structuring it in a way that you will be able to cope, I think it's really important to also have fun, because it's going to be a tough course. And so take the holiday if you can. You visit the loved ones, make the most of your time off as well as studying hard, because I think that, it's only going to go one way at nursing school, and it is going to be a really tough course. So it's important to do some self-care and to really appreciate a break and some kind of mindfulness and looking after your mental health and yourself before you go into a really rigorous course like nursing.
Okay. How about for once you're in nursing school and you're, and it can be a first year, it can be a final year, you're in the depth of nursing school, and what some might call a pit of despair at times, but
you're in the pit of despair. I think that there's a couple of things that I would tell myself. I would tell myself to get support if I was worried about things. So always ask for support from mentors, even if they're unofficial mentors. If you like the way that a nurse is working on the ward, there's no reason at all, even if they're not your mentor, that you can ask for support from that person. Get support from your peers, from your colleagues, and from your university teachers as well. But also, if there is a problem, then seek help as soon as the problem happens. Don't just go home after the worst day possible and struggle with any mistakes that might have happened during the day, whether they're yours or someone else's. Always seek help and always try and talk things through, because there's no such thing as a bad day in an office until you've had a bad day in an office at nursing school. And I mean, it really is the pit of despair. And so the thing to do when that happens is to make sure that you don't suffer in silence, that you get help, and that you also try and write things down, because reflective practice is so important and it's very therapeutic as well. So try and keep a journal is my advice about those days, and you never know, it could turn into a book one day as well.
That's some soul. Note to self, start writing stuff down.
Note to self. Yeah, write stuff down. Obviously keep things confidential, but it's a really therapeutic thing to do. And when you look back, you can sort of make sense of experiences that you might have had in the past. But certainly at the time, raise the alarm if you have to raise the alarm about anything that you see or do, and seek help and support from those colleagues around you. And I think, you know, if it is the pit of despair and you are absolutely at rock bottom, then you must tell somebody sooner rather than later. We have nursing students here in the UK who've got, you know, we have people suffering terrible mental health problems, and actually female nurses in the UK have the highest occupational suicide rate. Ooh. So it's a real issue, and I would, you know, this isn't a normal job, and there are going to be days which anyone in the world would find incredibly difficult to cope with. So it's about making sure that you look after yourself and get the appropriate help if you need it. And it's the cumulative effect of that stress will stay with you, and each bad day will add up to another bad day, and then you can suffer things like burnout and compassion fatigue 20 years down the line. So it's just really important to be very mindful of looking after yourself, number one, before you can look after other people effectively, and have fun. You know, I mean, most nursing students, particularly here in the UK, are young people, and life is precious and life is short, so it shouldn't all be about work. I think scheduling regular fun things, whether that's the cinema or a run or, you know, just seeing friends, I think is really important as well.
So best advice, like the one thing that you would want to pass on as an experienced veteran nurse to someone who is just graduating and getting they're a new grad RN, or RN in the US, but they're a new grad nurse, newly graduated nurse, and they're in their first job. Best advice?
I think the thing it's a bit like driving. When you've passed your test, you realize that your first day driving is actually your first day learning to drive.
Oh God,
and
isn't it?
When you've graduated from nursing school, you're out there on your own, and you realise you've started nursing school all over again. And it's a terrifying time, but actually you are ready. You have got a lot of experiences already under your belt, and the thing that's most scary is the fact that you haven't got that support system that you had as a student nurse. So it's really important to stay in touch with your student nurse friends, colleagues that you had. And we have something here called a preceptorship program, a newly qualified nurse program, where for 6 months newly qualified nurses are sort of mentored and given regular support. I'm not sure if that happens in the US, but I'm sure there'll be something similar like that going on. And again, I think it's about just giving yourself a break and realizing that your very, very first day as a newly qualified nurse is a bit like your very first day when you became a student nurse, and you will grow and develop and find your own feet. And it's about just getting the support of your team and those people around you. And if you are put in a situation where the staffing is really bad, or you're at risk, or your patients are at risk, or there's a safety issue, it's about speaking up, making sure that you are essentially protecting yourself, protecting your patients, and raise any red flags to managers and other members of your team.
Beautiful. Well, Christie, thank you so much for taking so much of your time. I really appreciate it, especially in the busy evenings during the week. Thank you so much for taking time to spend time with us and promoting your book. So it's available in softcover. It's the #1 international bestseller, The Language of Kindness, A Nurse's Story by Nurse Christie Watson. It's available in softbook, ebook, and on audio from Penguin Random House. I can say it. Penguin Random House.
Thanks so much, Michael. It's been a real pleasure talking to you.
Thank you. Take care.
Thanks.
I appreciate your patience as technical difficulties and several interruptions, as you probably heard in the background, made recording this episode particularly difficult. Not to mention, this was recorded in a hotel conference room the day after I buried my Grandpa Smith in Indiana, so thank you for your ongoing support and patronage. It was awesome being back with you today. Thanks for listening and helping me keep this podcast rolling. There's more to nursing school than just content. Remember, in nursing school, the only easy day was yesterday. We can get through this together, though. This Real Talk School of Nursing podcast is a Real Talk production. This podcast is dedicated in loving memory of my Grandpa Smith, one of the last tin can soldiers. Fair winds and following seas.
Sic semper tyrannis, facta non verba.
Good night, Steve Cannon.
Wherever you are.
Annyeong haseyo. Now you go home.
If you like the show, the Real Talk School of Nursing podcast is available on iTunes, Google Play, iHeartRadio, Libsyn Web's Player, and Stitcher, YouTube, Spotify, and SoundCloud. So go to wherever you download podcasts, subscribe, rate us, review us, write into the show, smash that subscribe button. Remember to leave only 5-star reviews because that's the only rating that counts to get us noticed by more nursing students. Write into the show at realtalknursing@gmail.com or on Facebook Messenger. You can also join us on Facebook, Twitter, and Instagram. We're building a community of fun and supportive nursing students, and I want you to be part of this crazy nursing school journey.
The Real Talk School of Nursing podcast is a holy moly, I can't believe you're still listening to this podcast.